Hello, this is Neil Baum giving a second component to a discussion on hiring and firing of your non-clinical staff. And in this segment, I'm going to focus on just how to effectively fire someone on your non-clinical staff without getting in any legal trouble. Ideally, you would like to follow a process of ready, aim, fire. But if you're ready and then you fire and then you aim, you might find yourself missing the target and getting into potential legal problems and litigation. The current situation is that the majority of employees in a clinical healthcare setting are non-union. And as a result, you don't have to have a cause for firing someone, and it can be what is referred to as at will. You need to know the state laws for each individual state regarding firing an employee and what process needs to be taken. Failure to do this properly can result in problems with morale in the office, and it can be very expensive to find a replacement. There are three reasons for termination, and I will go through them one at a time: integrity violations, layoffs, and non-performance. For integrity violations, this is very simple, and unfortunately, it's uncomfortable but easy to do. And this is if you catch an employee stealing, cheating, failing a drug test, or embezzling. This is a situation where you terminate immediately and let everyone in the office know that breaking the rules will result in immediate termination. At this point, you need to just do it and take away their keys, their badges, change the password, or remove them from the computers and escort them immediately out the door after they get their personal effects. The second reason is results of economic downturns, such as the COVID-19 crisis that we're currently experiencing. This is where you need to have transparency of the situation with your employees. They will clearly figure it out that if you have fewer patients, fewer procedures, that the income is going to go down and you're going to have to downsize. It is a nice gesture for these employees to give them severance pay, because you want to maintain a good reputation as a good place to work in the community. Also, it's a nice consideration to pay for their healthcare benefits for a few months while they're looking for a new job. One of the more common reasons for firing a non-clinical employee is non-performance. And this is where the employee did not perform up to your expectations or the expectations that were written out for them on their first day in the employee manual. You need to let the employees know before the firing where they stand, and you need to give a reason for a termination, and it's important to put it in writing. And essentially, you just have to state that the situation is not working out and it's time for the employee and the practice to part ways. You need to preserve their self-esteem when you're having this meeting. You want to offer them encouragement and let them know that there's a good place for them that can match their skills and their what they are capable of doing out there. And you need to let them know how you're going to handle their reference. If they can use you for a reference, and what kind of a reference you're going to give. You also should have, at the time of this termination, to have their check ready for them, so there are no additional communications needed between the employee after they are terminated. Very important to document very carefully any infractions or any discussions you have with the employee, particularly entering into their file the date that you met with them, the time that you met with them, the description of the event of poor performance, and the action taken. If you have a written document, if litigation does occur, you will be very happy that you have made a written documentation of this and placed it in their file. A few caveats. A terminated employee can represent your practice in a positive or negative fashion. How you handle the termination will determine the behavior of the employee after they have left the practice. You need to know your state laws regarding for cause or at will. Most states and most medical practices have an at-will employer-employee relationship, and they can be terminated for any reason. Of course, it is illegal to fire for any discriminatory reasons, such as race, gender, or sexual orientation. In summary, firing is going to happen in every practice. Every employee is not a match made in heaven, and occasionally you have to blow out that match. It's not enjoyable to do, but you can, by following these steps, make it very tolerable. For those of you who would like a copy of my white paper on firing non-clinical staff, kindly contact me at the address on the last slide. Thank you.